Many patients have a lot of questions about sedation, IV sedation in the dental setting. It's become known as sleep dentistry. And I wanted to clarify some things that might be helpful to patients before they come in, and even if they're looking to have sleep dentistry done in another setting or in another dental office. In the dental setting, sleep dentistry differs than what most people think. Most people have an idea that they're going to be put to sleep, and their idea stems from what they see on television. Patients in a room, team of doctors standing around, there's machines blipping, and the patient's completely unconscious. That's not exactly what happens in dentistry. There are different levels of sedation, and without trying to get too complicated, one must understand that the level of sedation that we can achieve in dentistry requires that the patient remain slightly awake. And by that I mean they have to maintain a cough reflex, a gag reflex that is protective in nature. Because we're working in the mouth and you still want the patient to cough or gag if they get a little water down the back of their throat. If the patient is completely sedated in a general anesthesia setting, they won't do that. So in the dental setting, patients are on a lighter level of sedation. That said, they still have very little, if any, recollection of the procedure at all. The third level of sedation is the one I initially talked about, which is IV sedation. And that's where the arm is stabilized. We place an IV into the arm and we inject the medication that way. Again, a lot of times we will add nitrous oxide and oxygen to that just because it helps the patient stay ventilated, and it means that we just have to give that much less IV anesthetic for the patient to remain relaxed and comfortable. So that's IV sedation. You'll be glad to know it's a very safe way to do dentistry. And if the patients have a lot of anxiety, it's a tremendous way of managing that. So we as clinicians don't have to worry about the patient's anxiety being managed. We know the medicines are managing it, and we can focus on our work.